I just want to welcome everyone to Brain Week. I want to welcome Dr. Eavan McGovern, and I'm Dr. Susan Byrne. We're both neurologists. I'll let Eavan introduce herself in a little minute. And we were training in Dublin together. That's how we knew each other a number of years ago. And Eavan is an adult neurologist and I'm a paediatric neurologist, but we're both interested in the field of transition, so the transfer of children and young people across to adult services, which is how we sort of work together. So we thought, for the purposes of Brain Week, what we might do is have a little chat about kind of our experiences during COVID and how it affected patients and how things changed for patients, and then a little bit about the kind of COVID-related neurological things that we saw. And then just a little bit about tips for kind of going forward and what kind of lessons we learned as well. So Eavan, I'll let you introduce yourself.
Thanks so much, Susan. As you mentioned, I'm a neurologist in Dublin. I'm a consultant neurologist at Beaumont Hospital, and I work also at the RCSI. I'm an honorary lecturer there, and we know each other from our training. So it's a real pleasure to be here today and to discuss some the challenges and also the positives that have come out of this pandemic and COVID. Yeah.
And I'm a paediatric neurologist in Crumlin, and I'm a senior lecturer in RCSI with the Department of Paediatrics and FutureNeuro. And up until quite recently, I was actually working in London. So my experiences are probably slightly, well, firstly, I work in a children's hospital, but they're also slightly different because of geographic location. So I mean, today is actually the 1 year anniversary, I think, of the Irish lockdown. It was the day that Leo Varadkar, the Taoiseach, kind of announced everything. So what did it feel like to be working in Ireland at that time, Eavan, kind of for medics in hospitals?
Yeah, I suppose it was an unusual time, I would say, at a personal level and then also in the workplace. I mean, this was something that none of us had experienced in our lifetime. And it was this unusual feeling of all of a sudden, everything that we know, all paradigms had shifted and nothing was really in our control. And then you were trying to operate and do work in that environment. Emotions were heightened generally. And I think in a hospital, you have patients that are anxious anyway, but now it's a time where we don't know what's going to happen. So emotions are heightened further. And it was just this feeling of unknown and what would happen and anxiety. I think there was a kind of a feeling of anxiety. I don't know, Sue, at that time, what you felt, what was the initial sort of.
Yeah, so I think we didn't lock down in the UK until slightly later, but we knew, we'd seen what was happening in Italy, and I think everyone was aware that something was potentially coming and that we were very, very quickly going to have to change the way that we were working. I think on a personal level, I was living away from home. I was living really close to a big hospital in London, in kind of northwest London, and really the thing that struck me was that the volume of ambulances. So every kind of hour, every half hour, every quarter of an hour, an ambulance would go past the house. And I'd never experienced that before. So on top of this kind of sense that something was coming from kind of the overwhelming news that we were being given, there was also this really heightened sense that something was on the way. So I think from that perspective, as you say, it was a very sudden shift in the way that everyone was experiencing life. And like now in retrospect, we can look back and we have all this information about what it means, for patients and in relation to lots of different things, but we didn't have any of that information at the time. We didn't know what it would mean. So I think really
that like when you're going through something first and it's unknown, it's that discomfort of just going through it and no one knowing what's happening. And I think, you mentioned about the sirens, and that was something that was really prevalent at the time. It was it was a feeling of sort of almost like a wartime, and, life was standing still and there was something that was happening and we didn't know what was on the other side, I suppose. Yeah.
From a work perspective, because we weren't a super acute specialty, so we do a lot of on-call, but we would manage a lot of patients in the community. And we really, you were talking about the anxiety, but you just wanted to make sure that those patients were looked after properly. So one of the big things that we did was within the space of a week, we moved the entirety of the hospital, moved a lot of the outpatient services to online. So I was thinking about like necessity being the mother of invention. Like literally, for 15 years as a doctor, I had gone into work every day. I had never thought I would ever be able to do my specialty online. And obviously it's very, very different. So we went to being like in every day to being in 1 week out of 3 when we were acutely on call. And then for the 2 weeks out of 3, we were doing virtual video consultations with patients. So I was doing things like, you know, trying to check kids' strength in their face by like having a candle on my side and lit and asking them to blow it out, you know, to really engage, you know, because you're trying to assess children on a computer screen and you want them to engage, and you're suddenly like the ways that you're working are completely different. And I have to say it worked brilliantly. Obviously you have to bring them in at some point to examine them. You do need to see patients, but once you've seen like a child or a young person for one consultation, depending on the condition, really the families found it amazing. Like they really, really took to the virtual consultations. So the video consultations worked really, really well. So I think kind of that, for me, that was a massive kind of, just in terms of the way things changed very quickly, that was a massive thing for the patients that we were seeing. They really, really liked it.
Yeah. And I think that's the thing, isn't it? It's like needs must. And we sort of had these clinics where people would travel sometimes great distances to, and now all of a sudden, either if in your hospital it was set up that you had cameras, but not always. At the beginning, we used telephones, and actually realized that the information, you can glean a lot of information from a phone conversation, and you take a really good history and you just have to adapt and adjust and do the best you can. But I think people ultimately really appreciated that connection, that, you know, they were still having that input with the hospital despite all of this going on. And I think it was wonderful how departments came together to ensure that remained for patients, that sort of ongoing review, that the outpatients, because neurology is such an outpatient specialty, that if that was to have just stopped, it would have been very difficult for patients, but also as a department to then come back having frozen the outpatients would have been very difficult. So it's something that you now see can work. So that
absolutely. And then for us pediatric neurologists, it was really special to be able to see families in their homes, because you don't usually get, you know, the opportunity to go into someone's home. So we had some kids who were discharged, and then we'd follow up with them with a kind of a multidisciplinary team clinic a few weeks later. And actually we'd usually get them to come into the hospital, but getting to see how they got on at home, you know, following them around, you know, mum's or dad's on the phone, following them around the house, was really like a really good way to kind of see how they were getting on back in their normal lives. So I think that definitely that's one thing that from the feedback that we've had from the young people and the families, that they really want to continue on with.
Yeah, I think as well, you know, from the adults' perspective, and particularly the older adults that are having to like travel great distances to come up to return appointments, that where possible, if they can have just that point of contact in a short space of time, they're not waiting in the waiting room, you know, they're not traveling these great distances, and it's all the better. As you say, if you've seen someone once, you know their case, and if it's feasible moving forward, I think it's a really good thing to hang on to, you know.
And did you see was there a difference in kind of who was coming to hospital or what was coming into hospital in terms of patients kind of over the last couple of, you know, few months when it's been locked down?
Yeah, it kind of changes, doesn't it? I find that it's changed. So when there's a lockdown, initially what happens, perhaps the cases go down. So the cases that you're seeing on call might go down. And in part, that's due to people maybe not wanting to come into the hospital. In part, maybe emergencies are reducing due to changes in lifestyle. We're not sure. But then post coming out of lockdowns, there's a little bit of a surge. So the feeling is that there are people maybe who are holding out coming in and that are coming in. So you're seeing people who might have presented 6 months earlier in normal times. Yeah. So I think that's probably, you know, a negative of all of this, is that it's a real fear, right? It's a fear of, well, do I go into the hospital? Do I expose myself to this risk? And as a clinician, it's a difficult thing when you're also trying to decide, well, I need to bring this person in.
What is the risk?
Is the risk greater than, you know, the efficiency of getting stuff done, or, you know?
And I think the big message that, you know, everyone has been trying to give as healthcare professionals is really, if you think you need to come to hospital, make contact and to come, because really, like, one of the things that we saw kind of at the time with young people, again, exactly the same thing, was that there were delayed presentations, so things like, infectious neurology things that we see, meningitis, things like that. Like, there were people who were thinking, no, we'll just wait and see, whereas before they may have gone in. So I think that was kind of one of the things for us. And the other really interesting thing for us was that we usually have loads and loads of kids in kind of under gen peds who would have kind of, infective bronchiolitis, and the wards are empty. So those things aren't coming in because, children really aren't seeing each other. So there were loads of kids born in the last year who've never met another child. Really, things that...
And I guess I wonder how that's going to affect development of children.
Yeah, so that's something that, is everyone sort of thinking about. So I was at the playground the other day with a little girl who was just looking at the other children, just intrigued by, so I think, everyone's brain, as they're kind of developing, is programmed to hit certain milestones at certain times. But you're absolutely right. I think, there are kids who've never met their grandparents, who may not have met other children. And I think we are going to have to kind of keep a very close eye on children and young people, just to ensure that that there aren't any additional things that they need in terms of their developmental things. But it's been a difficult time, I think, for young people and their families, especially those with the kind of neurodevelopmental problems, because lots of the resources that they would have, like school, specialist schools and things, have been closed. So it's been a difficult time for lots of people.
The strain, isn't it, on that family unit as well? I think in older people, in kind of the older generation, it's put significant morbidity in terms of depressive and anxiety symptoms. People who previously interacted, were in the community, and now they're cocooning and they're not seeing people.
I think it's very difficult for I think everyone across the board. Like, we certainly saw, I would have a lot of patients who'd have headache, and depending on what the stressors were, as part of the kind of headache syndrome, sometimes they did much better because, it was a quiet space. They got to do their schoolwork at home. But then other children, because, and young people, because they couldn't interact with their peers, there was an increased amount of anxiety, maybe an increased reliance on social media. So there were kind of a lot of pressure on the CAM services and things like that. So I think there are an awful lot of things, like resources for people available, but there's the fatigue, I think, as well, that goes with everything. And I think one of the things that we were all really worried about was, well, obviously this has never happened to any of us before, and we've been doctors for a while now. You do worry if something new like this comes along, that there may be kind of things within the specialty. There might be kind of neuro-COVID symptoms or difficulties. Did you see a lot, or have you seen a lot of kind of COVID-related issues? I know I can talk about kids in a wee second, but with the kind of adult patients.
Yeah, so I know there's been groups who've looked at that specifically. In my practice, I haven't seen a whole lot of it. I think people with COVID obviously are very unwell, and they develop sort of systemically being unwell, and they have vascular complications. Some can present with seizures. There has been hemorrhagic encephalitis described. I haven't seen it myself. But I would have probably seen more the side of neurology that has held off coming in, and then they come in and, they're a lot worse. But I haven't seen a lot of the direct sort of effects of COVID.
I think as you say, like, it's not a particularly neurotrophic thing. So it doesn't necessarily, so some viruses, we know like certain viruses really like the kind of nerves and brain, but I don't think COVID particularly is one of those, which I think for me was quite a nice and reassuring thing to see. And I guess the other thing for the group of people that I look after is that we initially, children don't seem to be very badly affected by it. And it's great that kids are going back to school, and that's obviously fantastic. I think the thing that we noticed, we didn't notice, but I think early on there was a kind of a signal from a group in Italy that maybe there were a small number of children getting an inflammatory condition, with a higher peak than they'd expected to see. And then it became evident that there were a very tiny cohort of children, and I really have to stress how tiny the group of children are who have an inflammatory kind of presentation after COVID. So with kind of inflammatory kind of fevers that don't really go away. Sometimes they get a rash, headache, and they can be quite sick, but they tend to do very, very well. So this was a group of kids with a condition called PIMS-TS. But just to reiterate, it's really, really uncommon, and we didn't see very, very much of it. So on the whole, children were very well. There were many children in hospital with COVID at all. So it was a different sort of, something that you hadn't expected to see, the inflammatory condition, but otherwise very well. I think the thing that we tended to worry about were, patients that we had with neurological conditions are often on, certain medications. They might be on immunosuppressive medications. And I think one of the big worries that everyone had, the patients, the doctors, was, are the patients safe to stay on the medications that they're on? Do we need to make any lifestyle adjustments? Who should cocoon?
That's the thing. I mean, guidelines were being made. So as you say, people who were on it, but equally you were starting people on medication and you were wondering, is this safe? But very, very soon, I mean, people mobilized and you were getting guidelines from the ABN or from various sources that were telling you, okay, well, in things like multiple sclerosis, these drugs are safe, this is what you should do. If you start someone on this drug, they should cocoon for a certain amount of time.
And I think that really struck me, kind of how quickly, big groups, big medical groups, patient advocacy groups got together to kind of put, to put the patient at the front and kind of think, okay, this is the information we have at the moment. What's the best thing that we can do for the patient? What do you think? Are there any other kind of things that you wanted to kind of mention, kind of in terms of, I don't know, maybe like things that people could do to kind of help their brains at this time, or kind of, people maybe who have neurological conditions or maybe who don't have neurological conditions, I don't know, to kind of help to protect themselves or help to keep themselves well from a brain health perspective?
I think mood plays such an important role on how healthy your brain is and how you feel, your outlook, irrespective of if you have an underlying neurological illness or not. So I think keeping your kind of mood good, and to do that, routine is something that I sort of say to patients, if you can wake up at the same time every day, have your meals, have things to look forward to, little rituals during the week, exercise, meet people on Zoom, go for walks, all of these things that we might normally do, but become all the more important now, because if we're not going outside, we really need to structure it. We need to think about it to structure it, right? Because that structure isn't in place. So that, I think keeping a routine and keeping a contact with people, whether that's virtual or on walks, And
I think we'll have to kind of start some, I know lots of different people are engaging with patients and with patient groups to kind of see what sort of, changes that have happened that they'd like to keep, and things that maybe they, because sometimes there are things that we can find really efficient, but actually then people are like, no, we hate that, or my broadband's terrible, or we love, I used to have families coming up to see me and they were like, no, we go to like Waterworld and, to visit all these different things when we come to see you. So we love coming up to London. So I think we have to kind of think about those things too. But I think while it's been a really difficult time for lots of, families, people who've lost their, loved ones, and kind of, I especially think of, specialties like anaesthetics and the emergency department, where there've been, real kind of changes and stresses, that there are definitely things that we can, take out of it to use going forward.
And I think generally people pull together, in times like this. I think you see the human kindness coming to the fore, that whether it's in the hospital, people are pulling together all the more, and I think that's a lovely side of human nature that you're seeing in this as well,
So I don't know, do you have any kind of closing remarks or any kind of things that you want to add or say?
I don't need to do something, Susan. Do you want to?
No, I don't really. I just want to say that I really enjoyed having a chat with you about this, and I don't know, hopefully kind of we're in a place now for going, there's great news about the vaccine, the programs are rolling out now, people seem to be responding really well, which is brilliant. The kind of vulnerable patient groups have been moved up the list. So hopefully kind of this time next year, when we're in Brain Week 2022, there'll be we'll be looking back on a time where things were, where things were bad, but actually there's great improvement. So lots and lots of hope. Super. Well, thank you so much for chatting to me this evening.
Thanks for having me, Susan.
It was lovely to talk. Take care. Bye-bye.
Bye.